Now, VTE, venous thromboembolism, is a common event. And what I've put up here are the results of a number of studies from the 70s and the 80s and 90s and 2000s to show that doctors have tried to estimate what is the frequency of this. How often do patients in the United States, this is United States data, get this problem? And it's very, very difficult to get exact data. One of the problems is that DVT, or pulmonary embolism, is often a complication of another disease. And so, for instance, if one goes into the hospital and has cancer, but in the setting of that cancer has a pulmonary embolus and dies, it's usually they die of their cancer. Nobody knows that they actually died of their pulmonary embolism. And so it's not written in the death certificates and elsewhere. It's just hard to get that data. And lots of other studies have been done. But based on a number of studies, it's generally agreed that there are probably somewhere around 300 to 600,000 cases of deep vein thrombosis, of VTE per year, and potentially about 100,000 deaths per year. Now, those deaths are generally from pulmonary embolism, not from the DVT. That's a high number. And if you look at the causes, if you go into Google and you say, what are the top 10 causes of death in the United States, you're going to see things like heart disease, cancer, and so on and so forth. But you'll see nowhere listed venous thromboembolism. It's not there. And in fact, this causes more deaths than lots of those diseases. It's probably the third or fourth leading cause of death in this country, but it's not listed because it's often seen as a complication of another disease. So that's what, and that's a struggle for the National Blood Clot Alliance, trying to make people aware of this problem because the public is not aware that this is a major health hazard and a preventable one. Now, if we look at some of the risk, and I'll talk about a few of the risk factors and so forth, one of the major risk is getting old, and it's a risk that we can't avoid. So, unfortunately. So, if you ask me, what's the incidence, what's the frequency of DVT, or VTE, I'll use the term VTE, in the United States, it's about 1 per 1,000 people. And that represents this number here. This is incidence per 100,000. So it's 100 per 100,000, or it can be translated to 1 per 1,000. Now that means 1 per 1,000 from the age of 0 up to the age of greater than 80. That's the average risk. But you can see that for young people, the frequency is very, very, very low. But as you get older, it tends to increase. And so for the 65-year-old individual, it's about 2.5 almost per 1,000 people. Now that doesn't sound like a lot, but in medical conditions, it's a fair number. And as you get, and it really tends to increase here a lot. And this change over this time is due to lots of factors. One, older people have other diseases that predispose to VTE. They also have vascular disease, and so on and so forth. So you can see that it's, and here we show the difference between males and females. So I just want to bring that to your attention, that that is one of the major factors. Now, the other thing that is something that the NBCA, National Blood Clot Alliance, struggles with all the time is public awareness, because the mission of NBCA is to make the public aware, to improve prevention, and to prevent disease. And so this just shows you a survey by the American Public Health Association a few years ago, where they surveyed 1,000 Americans, and about 3/4 had little awareness of what DVT was. 57% they were unable to name. These are the people who were aware of what DVT was. Over half were unable to name any of the common risk factors, and almost 100% said their physician never discussed this problem with them. That's our problem, is in terms of how we interact with patients. And this is the results of a survey that the National Blood Clot Alliance did a few years ago. Similar type of survey, a little bit more in-depth and detailed. And I'm not going to go over it in great detail here, but we surveyed individuals. We had a national sample. We had patients who underwent hip and knee replacement, and cancer patients and hospitalized patients and so forth. And I just want to point out that if we asked, have you heard, let's just look at the national sample of 500 people. Have you heard of a condition called DVT? 20% said yes. Have you heard of a condition called PE? 16% said yes. 9% said VTE. So nobody in the public understands what a DVT, PE, or VTE is. Not surprising. But if you say, do you know what a blood clot is? 82% said yes. And this was clearly a sign to us as a professional group that we need to talk to the public in terms they understand. We're not talking about, although I'm using the terms here because I define them for you, DVT and PE and so forth, and you're all pretty knowledgeable because you've had these problems. But in general discussions with the public, we really need to talk about blood clots so they understand. And there were a lot of other questions asked in this survey. And here, those who were aware of what a DVT was, could they name risk factors? And about 52% said yes. And those who knew or claimed to know what PE is, again, signs and symptoms, 34% said yes. For those who had knowledge or awareness of the seriousness of blood clots, here it's interesting that if you knew what a blood clot was, which was most of the people knew that it could be life-threatening, that it interferes with blood flow, that it can travel to other parts of the body, and so on and so forth. So again, it helps us in terms of how we speak to the public, the terms we use, and trying to educate the public, particularly the public who has not had a blood clot. That's the public we need to reach to make them aware of the risk of this problem. Now, what are some of the risk factors? I will just list these for you. We'll talk a little bit about some of them, but this tends to be how physicians think of this. Strong risk factors, moderate and weak risk factors. So the odds ratio here is greater than 10, meaning the risk is 10 times normal, what the normal risk would be for that individual, whether that individual is a 3-year-old or an 80-year-old, 10 times that risk. So people who have had a fracture or have had hip or knee replacement surgery after surgery, these are very high-risk conditions. Major trauma, spinal cord injury where you're paralyzed and so forth, these are major risk factors. Most of us tend to fall perhaps into this category if we've been in a hospital or have had a major illness, but clearly patients who have cancer or on chemotherapy, who have a central line in, patients with heart failure, hormone replacement therapy, estrogen therapy is a risk, cancer again, and so on and so forth. And then there are some weak risk factors, bed rest greater than 3 days. Now, that doesn't mean that if you're sick and you're at home and you're in bed for 3 or 4 days that you're going to have a DVT or PE. First of all, most patients are up and walking around their room a little bit. I mean, we're generally talking about strict bed rest and usually with other illnesses, but immobility, age, and so on and so forth. So these are some of the things that you should be aware of. And there are really more than these. You can list some, and we'll come back to this in a little bit.